suspending certain provisions of the open meeting law and the governor's June 16th, 2021 revised order extending remote participation by all members in any meeting of the public body. This meeting of the Great Barrington Board of Health will be conducted by remote participation to the greatest extent possible. Specific information in the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town's website at townofgb.org. For this meeting, members of the public who wish to listen to the meeting may do so in the following manner. See instructions at the top of the agenda. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. With that being said, we'll take a roll call vote to officially start the meeting. Peter Stanton?
Here.
Ruby Chang? I think you're muted as well, Ruby. I still see you muted, but I see your mouth moving.
We know she's here.
Yes. All right. And I'm here as well. Just nod your head, Ruby, and we'll know officially. Okay. Very good. We're all present. There you go. First order of business is approval of minutes from September 9th and September 15th. I trust everyone's looked at those. Did you send those out, Rebecca?
I included them in the meeting packet.
Okay, that's what I thought. I saw them there. There's been so many emails lately, keeping track. Okay, I'll take a motion to approve both sets of minutes.
I make a motion that we approve the minutes from September 9th and September 15th.
I second.
And I'm in agreement. So we'll just take a quick roll call. Peter Stanton.
Aye.
Ruby Chang.
Aye.
And I vote aye as well. So we'll move right along to an update from the Berkshire Public Health Alliance. I think Laura's here with us for us tonight.
Laura, are you here? And Leslie?
I see a Leslie.
I'm here, but I have to turn off my video because it's saying my internet is unstable.
Well, that's just fine.
That's where you'll be able to at least say, I don't know where Laura is. I can kind of start, I guess. I'm the lead public health nurse for the Berkshire Public Health Alliance, and I've been doing your services for about 5 years now, I think, maybe 6. Doing all your contact tracing and Maven and flu shots and education down in the Great Barrington area. Everybody, I'm sure, pretty much knows what the Alliance is, because I think that do you guys all know?
Yes.
Okay.
Yep.
So basically, I thought I would just give you a quick update to let you know you have absolutely no COVID cases down in Berkshire and Great Barrington right now. I've run a report for the last week. We have about 79 cases in Berkshire County of the towns that I have access to that I can state.
Which is about 24,
Yeah.
right, Leslie?
24. Yeah,
The
about
Alliance.
24. I think there's 24 Alliance towns. And we have 79 cases, and of them, we have, most of them are in North County. It's really interesting. When COVID first hit, it went from the north down to the south, and this time it went from South County up to the north with this last little wave. And we have about 50% of the cases have been vaccinated. They're now able, they can show me which vaccinations are given, and I can say that it is both Pfizer and Moderna and Johnson and Johnson that are having breakthroughs. Your biggest Maven report, we had a little bit of a cyclosporiosis recently, but it's gone, it looks like, down in that area. And mostly now we're just seeing tick-borne illness down there. I did a flu vaccine clinic at the Claire Teague Center yesterday. And we actually vaccinated about, I think there was like 34 or 38 people that came in to get vaccinated, which was good. And then we went right from there to Egremont and did a boatload more. So we're starting to get flu shots into arms down there. We chose not to do the booster shot at the same time because we wanted to focus on flu. And there's Laura, now she can tell us.
Hi, Laura.
Yeah, and it's just,
I'm so sorry I'm late.
That's okay.
good to see you. I just want to supplement that it's really challenging to do COVID and flu clinics at the same time, since a COVID clinic runs totally different than a flu clinic. You can get vaccines or flu shots in people pretty quickly, whereas there's a 15-minute monitoring period for the COVID clinics, and the storage of the vaccines could get really complicated. So I think that if the Public Health Alliance does choose to do booster or additional COVID clinics, it's better for operations to just keep them separate.
I agree.
But good
And I
to
think
see you.
as I said too, I'm kind of looking down the line to the 5 to 11-year-olds. If we can dose them, we might be able to do, kids and then maybe do some boosters at the same time. But, obviously at this point, the kids were my priority. I want to get as many vaccines into kids' arms as I can.
I would also add about the boosters that the federal government's prioritizing the pharmacy chain for distribution of vaccine. So even if we wanted to do boosters, there's I'd say some question, but it's actually not even a question, that we would have difficulty getting sufficient vaccine because they're prioritizing the pharmacies to such a degree. And I'm seeing that if people go a week, 10 days out, they're having no trouble getting appointments at the pharmacies at this time.
Okay.
So again, I apologize for being late, Michael and
Yep.
Rebecca and everyone. I sounds like Leslie was doing an awesome job of updating you all.
Yes.
I don't know if you want a little bit of an update on the public health nursing and the Alliance
Oh yeah.
kind of in general. I'm happy to do that. Or if you're still have questions for Leslie, she can certainly handle that. And is Nancy here? Did Nancy get introduced?
I didn't see her on there, but that's really important that we were able to hire a full-time person. Nancy Slattery has come and joined the Berkshire Public Health Alliance as a full-time public health nurse, which is great. She has a lot of experience. She's been doing it a long time. So it's really been a pleasure having her there.
Yeah, I would add to that. We were very fortunate. So there's been one of the few silver linings of COVID has been a recognition at the state level of the importance of local public health, and that local public health has been struggling for far too long with far too few resources. And, in Massachusetts in particular, where we do it town by town, this works great for some things, but for responding to a large scale emergency can be problematic. So there's been some grant programs that have been available that we've been able, as the Berkshire Public Health Alliance, with a structure in place already where we share services sometimes, and to some degree, we were well poised to apply for that. And so we were able to apply for the Public Health Excellence Grant, be able to hire Nancy full time. So once COVID's over, which everyone laughs when I say that, they will be able to concentrate on some wellness, some chronic disease prevention, all the things that local public health and public health nurses should always have been doing, but which we never had the resources to do. So I'm really interested in hearing from the board, not necessarily tonight, but at some point, about what you see as the priorities in town and in the county for the nurses to start thinking about. Probably not until, early winter, late winter, early spring. Once, as Leslie said, they vaccinate the kids and finish the flu clinics and so on. And hopefully we see this surge continue to go down. But we were also able to hire another inspector, which is really important for our inspectional services program, even for a town like Great Barrington, where all we do is back you up on occasion when you need it. That capacity is there or will be there. And we have an ad out now for a shared services coordinator. So somebody who can do a lot of the grant writing as well as a lot of the admin work and, just kind of being that point of contact for the Alliance.
Okay. I do have one general question just about on COVID. I was curious if you guys are privy to or aware of our neighboring regions, like over across the border in New York or down in northwestern Connecticut. Are they seeing the same decline in cases?
I
don't have.
Yeah, go ahead, Leslie.
I don't have access to that information, Michael. I can only see what you see and
Okay.
hear. We don't get a lot of the reports from Connecticut or New York, unfortunately.
Okay.
I will say that we're seeing declines across the country for the most part.
Right.
And really across the world, we're seeing declines right now. And, except for a few places like out in the West, but even the Southeast is seeing real declines. In Berkshire County, our cases have tended to track New York more closely than they've tracked the rest of Massachusetts. We tend to go up a little bit later. Well, in the beginning, we went up more quickly than the rest of Massachusetts and then down earlier. This time we went up a little bit later and we're going down a little bit slower than the eastern part of Massachusetts. But yeah, we don't get, we don't see anything you can't see for New York State.
Okay, very good. Do you have anything to add, Rebecca, or any questions for the rest of the board?
Well, I do want to, if not now, talk about some things that we would like to put on the Public Health Alliance's radar for maybe this winter or early spring, when we can kind of move away from prioritizing pandemic response and really utilize our additional public health nurse services. I think this is really great that the Alliance now has 2 full-time nurses. So we can put this on a different agenda to talk about, or we can throw out ideas now, however you want to move through this. But I also just want to say that what Leslie has done for the town of Great Barrington for the last 18 months, even before that, but especially during the pandemic, is really, really incredible. And I just want you all to know how hard she worked on your behalf, on the town's behalf, really doing all of the contact tracing for Great Barrington and all of the follow-up and providing that critical touch point between people who just, get this positive test result and they don't know what to do. And here they are, they know they need to quarantine, but what does that mean? How do you do that safely when you have a family of 5 or loved ones in the same household? So Leslie has really been our superstar, and I just want to congratulate her and want you all to know how hard she worked. And now Nancy is part of the team, and I think that we're well stacked.
Thank you, Rebecca.
Yes, well, thank you, Leslie, and for all the work that you've done. I did hear and have heard along the way. So I'm very thankful and grateful for your hard work during the past interesting year and a half, to say the least. I don't have anything else to add or to ask, and I think we can certainly think about it for the next few months, and when we have a little bit more time in our meeting and have some time to develop some questions. I think that might be more beneficial than trying to just shoot from the hip tonight. If that's okay with you, Laura?
Yeah, no, it's fine. And, we'll do a more formal process of really looking at the data. And we're doing that as part of our community health improvement plan, which is something we've been working on for the last 18 months, but has been very much slowed by the COVID pandemic. And we'll be looking at data and so on. But we really want to hear from the ground, and from our boards of health, what they are seeing and what they see as the biggest issues. But I agree with you. And, sometimes a board has something that, is on their mind and they want to mention it right away. But we'd like to come back in a few months and, kind of draw that out a little bit more, or logically, rather than.
Yeah, definitely.
There was,
Go ahead, Peter.
just one thing while it's on my mind. One of the things I remember from the past, and as seems like we're going to be able to start thinking about other things besides COVID. I remember in the reports through Maven, and I think it was mostly the reports related to Maven, where we were always interested in knowing what the data was a year before, or some comparison data.
Yep.
And I remember that would have been really helpful along the way. Just to put that out there.
Yeah,
we were
go ahead, Rebecca.
I think we were getting quarterly reports, and I don't know when you want to put those back online, but I think that's when the conversations would come up, is when we would get our quarterly reports. If we could see the 4 quarters prior data compiled, so we could compare how this spring was with last spring with tick-borne diseases or arborvirus, et cetera.
Yeah, and so at the last Alliance Governing Board meeting, which I think, I don't remember if somebody was there from Great Barrington, but we did do that for kind of the county. And I will just say, tick-borne illnesses were up this past year. The nurses were slammed with that on top of COVID, as was the population. And Leslie, I know that you saw a bunch of foodborne illnesses last spring as well, which is always worrisome from the public health point of view. But on the other hand, we saw a real decrease in, say, flu and that kind of thing, because people were staying home and wearing masks. So, respiratory illness was way down. Leslie, do you have anything to add to that? And then we'll make sure you start getting those reports again.
Yeah. I'm hoping that I can at least get one out, and I would like to do one from July 1st to the end of December type thing, like the 6 months, and then go back to the quarterly reports, if that's okay with you. I'm hoping by December that maybe I'll be able to have some time to do some of that stuff. Hopefully as June, as Nancy ramps up, I'll be able to have a little bit time to run your reports for you. But I'll try to continue to get them to you monthly.
Okay, very good. And I do recall that at one point we were seeing some either comparison data from either years or quarters before. So I knew you were starting to do that. So I second with Peter that it'd be good to continue seeing that. Yeah.
Yeah, I think that's important for you all to see as the Board of Health, because it's, if you start to see huge upticks in something, that's something you want to pay attention to. If it's something you can do something about, a big uptick in hepatitis C may mean a drug issue or, whatever, the tick-borne illnesses and so on. On the other hand, if you see a decline in something, you want to celebrate that. So we'll definitely try to get those back online in the next couple of months.
Good. Okay.
Thanks.
Can I just ask a quick question that's been on my mind for a while I have Leslie and Laura here, looking into future after COVID is much settled. I have been working with immigrant population and taking care of their children, and I was wondering whether the Alliance have any plans for reaching out to the immigrant population who have large language barriers, who have very limited resources, and since they don't understand any English, And it's very hard to reach them to give them the updated information, such as vaccinations of 12 to 17-year-olds. And usually the COVID outbreaks has been within close-knit families because they live in very close environments with each other. I would like to hear how has the Alliance provided support for that population?
So we did a lot of vaccinating. We worked with Vim. We worked with Alana at Vim. And she was great at getting people registered, getting them vaccinated, making sure they showed up. And if they showed up late, we just stayed and dosed them and did what we needed to do for them. The other thing is Berkshire Health Systems has been phenomenal working with us and has given us access to their interpreter services. So several of these Spanish, mostly Spanish-speaking populations and families, I am able to use an interpreter service, and it has worked wonders, getting them to start talking to me. And then, Ruby, they actually do a lot of texting with me because there's the text to English, and they'll text me questions, or, they'll say, I need to talk to you, and I'll say, okay, I'll call with an interpreter.
Yeah.
So we've been able to open those lines of communication more with different languages. And, they have interpreter services for every language. So it's worked very well. And I will continue to do that.
Yes, the interpreter service at Fairview I've worked with pretty much on a daily basis, and I really, trust them. They're wonderful interpreters. They do a great job, and they actually have gotten to know some of the families, which is really nice. It's good to hear that you have that access to their support, and that's good to hear.
Good. Any other questions or comments? Okay. Well, I don't have any at the moment, but I want to thank you, Leslie and Laura, for coming and not only saying hello, but giving us some good updates.
Are citizens allowed to make any questions here, or?
Just one moment, please. So thank you again, Laura and Leslie. And we'll look to get you on the agenda, say sometime beginning of the new year. How does that sound?
Yeah, January or February would be perfect. Again, I really apologize for being late tonight. I lost track of time, and I promise hopefully in January, February, we can come down in person. So
that would be nice.
That would be great. And, always reach, I know Leslie's on everybody's speed dial and everybody knows her phone number, but always feel free to email me as well if you have questions that are, a broader administrative level. And she's obviously the best person in terms of specific infectious disease questions and medical questions and that kind of thing. So really appreciate the chance to come, and we'll see you in a few months.
Great.
Thank you.
Thank you.
Thank you, Laura.
Thank you.
Thank you.
Are we going to be able to hear Kathy and Andrea's questions, please?
Excuse me. We do have a time at the end of our meeting for general comment. Typically, our procedure is for agenda items that are not either a public meeting, or we usually try to save, sorry, not a public meeting, but a
Public comment period.
public comment period, yes. We try to save all comments and questions for the end of the meeting. So unless you guys have some procedural questions, I'd ask that you hold those till our citizen speak time.
Yeah, the one question was just for Leslie, though, and I don't know if she's offline already, so that's why we were trying to catch her before she left.
We can.
Can I just, since we're jumping into this now, I think it might be a good idea to just go over our procedures in terms of addressing the chair and having time to speak during a public meeting. Do you want me to just go over our general policy?
We might as
Michael?
well. We might as well while we're between items here.
Okay. So a point of order, you have to address the chair for permission to speak. You have to state your name and address for the record. So you have to be specific with your actual physical address. So 334 Main Street, Great Barrington, that type of address, not just a resident of Berkshire County. And I think we would like to limit everyone tonight to 3 to 5 minutes. And we want to prioritize folks that live in Great Barrington first. So if you don't live in Great Barrington, I just kindly ask that you wait until the end of the meeting and after folks from Great Barrington have had a chance to speak. So also, I don't know if Leslie is still on or if she is willing to take questions at this time, or if the chair is willing to allow a public comment period. But if you do have specific questions for our public health nurse team, you can always email me and I can forward that question on, or I can get more information to then provide to you. But our nurses are a contracted service, and we set their workflow. So they are accessible to the public, but monitored through the health department since they are contracted.
Yes, and Kathy, typically we'll take questions as we go, but with tonight's meeting, I know that we have the glyphosate issue that's going to take up some time, and I also anticipate some hearing from the public quite a bit. So tonight I'd like to just move along as quickly as we can, and if you do have any questions, like Rebecca said, please send them along to her, and we can try to get you answers to those as quickly as possible. So I'm not trying to shut anyone down, but tonight I'd like to move along and allow people to speak on the topics that we have, because I think it's going to be give them time, in other words. With that being said, I think we can move along to our public hearing. Our discussion and vote on enacting a temporary ban on the use of glyphosate containing herbicides on town-owned or managed lands for a minimum of 1 year. So I'll look for a motion to open the public hearing.
I make a motion to open the public hearing.
I second.
And for procedure, we'll do a roll call. Peter Stanton,
Aye.
Ruby Chang,
Aye.
and I vote aye as well. Okay, Rebecca, do we have a little presentation or just a synopsis of where we were and where we are?
Yeah, I wouldn't call it a presentation, but I'll just give a timeline. I know you were all along for the ride, but here's the recap. I think it's been 2 years this October that we began looking into glyphosate and its public health effects on humans as well as animals and our food sources. So we've had a lot of discussions delving into the research, and now we're at this fork in the road where we need to decide if we want to vote on enacting a moratorium. And this moratorium would ban the use of glyphosate on town-owned, operated or operated properties. And there is precedent for this sort of thing. A lot of communities in the eastern part of the state, namely Plymouth and Barnstable County, have moved forward with permanent policies or bylaws or even a moratorium on glyphosate containing herbicides in Plymouth and mostly Barnstable County. The aquifer that residents access for their drinking water is pretty shallow. So, they wanted to pass some regulations on herbicides because it would directly impact the safety of their drinking water. Great Barrington is a little bit different. But it's, there's a lot of good reasons to move forward with this. This moratorium, if affirmatively voted on, it would take effect immediately. So you can set the date, but I tentatively have in the draft that it would be from now until October 2022. And like we said at the start, this moratorium is temporary, and the intention is for it to be 1 year, and we take this 12-month period to assess what it looks like to have a ban on this type of herbicide on our town-owned operated properties. So the intention would be to hear from invested and then just also community members on what's working, what's not working, emerging research, and take that all into consideration with maybe the goal of coming out of this 1 year moratorium with some permanent policy or bylaws or regulations that we can establish. I also just want to add that, we are aware of the potential benefits of having a precise application of glyphosate on unruly, rogue swaths of invasive species. Obviously, there are folks in the community that do this for a living, and it can be beneficial to restore native or diverse habitat. So, for this reason, we've added a paragraph or a section in the moratorium that allows for variances. And so the process of obtaining a variance would be, in the course of this 1 year or any future permanent policy, if you want to apply to use glyphosate on town-owned or operated property, then you would, submit that request in writing, and the Board of Health would review it at their next public meeting, and they would decide whether or not the risks or the benefits outweigh the risks, circumstance by circumstance. And then also there's a provision at the very end of the moratorium that, at some point, if we decide that it's really just not beneficial to continue with this ban on glyphosate, then we could terminate it prior to the 1 year. So that's the layout. Do you have any questions?
I don't. Do you, Peter or Ruby?
No, I don't.
Yeah, I think the one thing we had talked about, and I understand how you put the variance in there as an option or a way for professionals who are using this to, to get approval. And I just wonder about that approach versus just saying that contracted professionals who are doing work on the land can use it. If it makes sense to them in the scope of their work. Just the only difference I see being if we're creating a barrier to them moving forward with the project by having to come to the Board of Health. So I'm not advocating one way or the other. I'm open to that. I think that I think we've seen the moratoriums and the news about this happening in other towns. We've talked about it a great deal. We got a really strongly written letter saying that it's not a good idea and that we're putting the cart before the horse. But I still think that the main reason we're doing this, because we're talking about something that is somewhat benign in terms of we're not really utilizing it on town land at this time, and if we have a way for the professionals to be able to use it, then really in the end of the day we're just making a statement, and this is just a kind of a first step of saying that we're generally in support of people paying more attention to the topic instead of just using the stuff. And yes, we have no influence over the agriculture in our areas, the influence over private use or any of the other places this is used, but those people get to see that we're making some kind of statement that that we're thinking this is a product that needs closer scrutiny and some monitoring. And so hopefully take a hint and or down the road, there can be more guidelines for them in, through other avenues. Anyway, I just wanted to say that I think we're making a statement, and I think we're, I'm fine going with the variance plan or the professional use plan.
Yeah, Peter,
I-
oh, go ahead. Go ahead, Rebecca.
Thanks, Peter. I also wanted to make clear that a goal or an intention for the duration of the year would be to establish a working citizens group, or like I said, an invested group to help develop something, whether it's a statement, whether it's policy, going forward, so that it is collaborative and it does have everyone's interest in mind. And I don't know if I said that clearly before, but I wanted to add that. I just want to add that in there.
Sure. Peter, I have had thoughts very similar to yours. And I've been wondering this week, partly in response to some of the emails we've received, partly my own experience where I live, and seeing the problem with invasives and knowing the professionals who deal with them very effectively, and also knowing that on our side, I mean, way back when, I was always apprehensive about creating something that would funnel all sorts of applications through our department. And while I don't see that being a real problem, I'm always looking for a way to, of course, streamline any process. And so part of my thoughts these past weeks and days has been, if we, rather than have a variance mechanism, perhaps we could have more clear language about that, an exception being made for licensed professionals in their work and dealing with invasive species. I'm sure we could have a precise wording that would be very clear, but I wonder if that would be something where we could strike a middle ground where we're still making our statement, but we're also acknowledging the problem that invasive species are in our environment, and the good work that many individuals are doing and have done, and work that's even ongoing in places like our own in McAllister Park, right up the road from where I live. And so I was wondering, going into tonight's meeting, if that's not something that we should seriously look at and change. While we have a paragraph, if we could make it more clear. I don't know how you would feel about that, or if that's kind of what you were thinking.
I think that I'm guessing there isn't a license for using this stuff. So I would say that we'd have to go loosely with some kind of professional, their business includes, this is, within the scope of their business.
I do think, not to interrupt you, but I do think there is such a thing as a license for being properly trained in applying this. At least I've heard that terminology used over on the CONCOM. So I think we could use that type of language.
I'm sure Sari or Tom could help us out with that detail.
Sure.
But either way, I do think that there should be, I think it's a good path to go down, and it's going to be a little loose, but I don't think that changes the statement that we're making.
Right. Yeah. And I think, I know it's been said before, but I think our town has done well in the fact that there's been an informal policy of not using these types of product as a rule, which I think shows some of the good thinking that's being done in our town workforce. Ruby, do you have any comments to add on that?
Yeah, I've been doing some research, just looking at scientific articles. I think I sent one to Rebecca. And I do want to, look into it a lot more. I do agree with Peter and yourself, and I would like to hear what kind of training of professional users of glyphosate have, and how does that protect our groundwater? And does the training really involve looking at our groundwater and making sure that is protected when they do use the glyphosate. The evidence, I mean, it's not that clear looking at the publications from Europe, who had multiple, authors discussing glyphosate. But the evidence from the NIH website, there's still a lot of controversy, I think, and we do understand from the good work of people who are really very much involved in our keeping our natural environment, the trees and the invasives that they've been working hard on. I do think that we should give them voice as to understanding how the training is, and whether we could grant them just a license to use under their training without having to come to us with every application. I just would like to get more information from their standpoint, because I do feel that the invasives is a problem. It's a huge problem here. And I don't want to kill the goose for the egg, so to speak.
Right. Okay, well, we can certainly discuss this further. I'm comfortable with moving into a public comment if you guys are,
Yes.
and then we can come back around and
It seemed like we had a couple questions, and I'm just wondering if there's a couple key people for those specific questions.
in terms of, we had questions about the a license applicator question.
Yeah, those kinds of things, yeah. Exactly.
Okay.
Before you open it up to the public comment period, you want to just hear from specific people?
Mr. Chairman?
We could do that. I believe I saw Sari.
Yes, I'm here. Sari
Well,
Hoy.
you're here. If you wouldn't mind, since we have that specific question, and I know you've spoken at our meetings before, if you wouldn't mind kicking off our public comment time, that would be much appreciated.
Sure. Sari Hoy. I own a company called Native Habitat Restoration. We're based in Stockbridge and Sheffield, and we do work in South County. Well, we do work in Massachusetts. So for a professional, for the town to use any herbicide or pesticide, let's just say pesticide, any pesticide on any property, whether it is a volunteer, an employee, or a contractor, any person that applies herbicide, whether they do it at no charge or for a charge, must have a Massachusetts pesticide license to do that.
Okay.
And so, and that does include, like I said, that includes volunteers. So if your staff were to apply herbicide, they would also have to have a license.
Right. That was my understanding. And while we have you at the microphone, so to speak, do you have anything else you'd like to say yourself?
Well, I do obviously like the idea of not having to come in front of you every single time we might be applying herbicide to a town property, but we are totally willing to do it. And for the most part, we're going in front of the Conservation Commission. The only time we've ever actually applied herbicide, I think, on town property, we'd have to go through the Conservation Commission. Well, we did do it once when you had a small Japanese knotweed problem in one of your parks. And it was a very small, for an example, to catch it at that point was perfect because we managed to control it with one application with about 4 ounces of glyphosate. So I think making it a more straightforward process for an organization or a person who's already been licensed and gone through the state licensing seems reasonable to me.
Okay. Well, that's great. If you have nothing further to add at the time, we'll move along. And
I have lots to say.
Oh.
I'm not a Great Barrington resident, and I'm happy to just say my bit and move on for now. But maybe I'll come back later. Thank you.
Okay, great. Thank you, Sarah. Okay, I see a bunch of hands up, and I will take them in the order that they popped up as far as I see them. I see someone signed in under Town of Great Barrington, who's first in line. Oh, just a moment.
Yeah.
There you go. You're unmuted.
Hi.
Hi.
I'm Vivian Orlowski from Lakeview Road in Great Barrington, and I chair the Agricultural Commission in town.
Oh, hi,
And
Vivian.
I have two
It's
very
nice
brief
to see your
comments.
face.
Pardon?
It's nice to see your face in person. I don't think I've ever met you in person, so.
Thank you. I don't know if I've been in previous meetings. It's a good point. Before I give my brief comments, I did have one correction to the moratorium. I was glad to see you mention the town meeting resolution to be a pollinator-friendly community. But that was in 2016, not 2017. So please correct that before you make it an official declaration yourself, because we were the first town in New England to have town meeting or any other municipal body a vote to affirm. This was a voluntary resolution. It was not an enforcement action, but it was to recommend limited use of pesticides and other pollinator-friendly practices on town land and to serve as a model for the rest of the community. Now, in terms of this moratorium, my comments were to thank everyone on the Board of Health and the health agent, Rebecca, for developing the proposed moratorium on glyphosate use on town-owned and operated properties. Here, let me get this on the screen here so I don't have to look down. Consistent with the town meeting pollinator-friendly community resolution in 2016 and the detailed Great Barrington Pollinator Action Plan in 2018, the Agricultural Commission appreciates the moratorium's promotion of a healthier environment for pollinators as well as for people on town properties. Let me just get to the rest of this. During the moratorium, we hope that the evaluation of pesticide use will focus on environmentally healthier land care practices as an alternative for the town and to serve as a model for residential lawns and gardens, schools, farms, and other businesses. However, we need to recognize that as a right to farm town, Great Barrington will not seek to legally limit on-farm practices, including use of glyphosate on farms. Instead, the town should help farmers locate grants and other support systems to help free them from dependence on glyphosate products, which often their livelihood depends upon, if they wish to make such a transition. This fall, the Agricultural Commission is preparing for a grant-funded project called Growing Better Great Barrington. And that can contribute to the Board of Health's evaluation during the moratorium period, because that project will take place starting in January 2022 and go to the end of that spring time. This is a food system plan that we're doing in collaboration with the Conway School of Sustainable Landscape Planning and Design, which we work with very successfully in developing the Great Barrington Pollinator Action Plan. And we will be in contact with the Board of Health to request your participation in food system planning processes in order to help the town enhance climate resilience, environmental sustainability, and community food security, which depends upon all these different practices. So let's work on future collaboration, and we support your efforts on that behalf. Thank you.
Great. Thank you, Vivian. I see Kathy Regan next.
Okay, I've got a couple quick things to ask right away. I guess it's concerning to us to start right off the bat that it's been a full 2 years of conversation for the glyphosate, only to get to a point after 2 full years that there's going to be a statement made and not real action against a product that has got countless studies showing the toxicity against children, wildlife, and adults. I mean, it's incredibly toxic, peer-reviewed studies, countless ones. So that's concerning.
Kathy, if I could interrupt you, just as one small point about it, I don't mean to nitpick. If you could just state your name and address, just for the record.
Sure, Kathy Regan, Grove Street, Housatonic.
Thank you. Please continue.
So that's concerning about the procedures for the health department because we're particularly, I mean, glyphosate is one huge issue, but we're particularly concerned about what's happening with COVID right now, with the mandates, with the vaccines. And what I had wanted to ask Leslie, I don't think she's on any longer, but, you know, do they know the exact stats of how many people have died from the COVID injections according to the CDC? How many?
Kathy, I'd be happy to get those answers, but we just want to keep questions on the glyphosate issue at this time, and we're happy to take any and all questions you might have, general questions or about anything later on, just so we can move through for people who are here just.
Then my specific question for the glyphosate is then. What exactly, if it's not really going to be stopped? I mean, because that's what's being indicated. How will the public be notified? People with small children, you know, where and how these things are being sprayed, so that people that don't want to be exposed to these chemicals will know. What's the procedure for that?
Let's see. I'm not particularly familiar exactly. Sarah, if you're there. Is there a particular procedure for notification?
Well, let me just jump in here. I think Kathy's question was specific to the town's notification.
The town, okay. I would think that we would notify if it was going to be done in places like a park or anywhere where it was very accessible, or just in general, that we would have notification be put up. Yes, definitely.
Has this been being done over the past 2 years while it's being discussed? I mean, is anybody at a park notified, or, and, you know, it's sprayed all over. It's sprayed by, power lines, sprayed by railroad tracks. So are people notified when it's sprayed even? Has that been happening?
I think, and those use on utilities, I think they have basically free reign to do what they do. And so and part of this whole thing is this is our first foray into dealing with this issue. So as a general, correct me if I'm wrong, Rebecca, but as a general rule and policy in the past, we've never even addressed this issue. So this is our first time wading into it. But as far as to the limit of my understanding, utilities such as the electric utilities or railroads, I believe they have their own procedures. And for all practical intents and purposes, I think they can pretty much do what they need to do on their property, their right of way. I may be wrong about that, but that was my understanding to this extent. But for the purpose of our discussion, we're just talking specifically about town-owned land.
Well, that as well. I mean, parks and things. I wanted to know because I was on a meeting a year ago that this was being discussed, and someone at that time was a little frustrated because it had already been discussed for a year prior to that. Yes. So it seems that this has been a very slow moving, a lot of very concerned people. So I'm mostly concerned if this is going to keep on going, how are people being notified at parks, for instance, you know, and other public town land when this is happening?
Well, let me just say that as a general practice, the Department of Public Works does not use glyphosate containing herbicides routinely. So we don't use Roundup. We don't just spray our parks with glyphosate containing herbicides. It's not official policy that's followed is that the DPW does hire a licensed applicator when there are problem invasive species. And I think that that's only happened once in the last 5 years. And I can't speak historically beyond that because that's as long as I've been here and our current DPW director. So different policies might have been, things might have been done differently with different DPW directors. In terms of where the Conservation Commission has their own jurisdiction, so they're charged with operating or oversight of the McAllister Reserves.
Recording in
That's
progress.
Definitely a public process where folks can, offer input, or it's a public meeting, so anyone can go and get information that way. But as Michael said, this is our first foray into banning it, into regulating it, and I think that you brought up a really important point. That if we do entertain variances, then we absolutely need to utilize our code red system or some sort of notification system to let people know that this is what's happening in their parks, and you can choose to not visit that particular park for however you feel is safe. But anyway, just wanted to add that that we only have control over, or we only have a say over what happens on town-owned property. Anything on private land, which includes the railroad or public right-of-ways, that's outside of our jurisdiction, and I can't really speak to what their notification systems are.
Right, and we'll also be happy to inquire to see specifically what the requirements are and what the procedures are for those licensed applicators who do use it. And like Rebecca said, it's been a very limited thing. So we're happy to get those answers. We'll move on to, I believe, now my screen has changed. I see Daniel Seitz.
Right. Good evening, everyone. Thank you for this opportunity. I just want to say I think it's a good move that the town, that you're considering this temporary ban.
Name and address, please. Or your address. Did we get your address?
Yes. 31 Pleasant Street in Great Barrington. And I also just want to say that I served for 5 years on the U.S. Department of Agriculture's National Organic Standards Board on the committee, and served on the committee that looked at genetically modified products.
Yeah, food with the kind of food that stays fresh for up to 25
Maybe Bill Grant can be silenced. So, we certainly had discussions on the impact of glyphosate on farmland and so forth. And there's no question that it does poison soil and it poisons groundwater. It's cancer causing. And even if there's a federal agency that has not yet definitively decided that it's a harmful chemical, there's ample evidence out there. And in fact, Monsanto and now Bayer have paid out millions because of the harm that has been done to individuals, including people who have applied the herbicide. I can understand that there is an issue with invasives, but also glyphosate creates super weeds, and that's been a real issue for farmers. So if you're perhaps removing one problem, you may be creating another problem with the application of it. And even if you're using it in a very focused way, so much pesticide use and herbicide use is happening that there's a cumulative effect on the toxic load within our environment, and certainly then the impact on individuals. So You probably have explored ways to deal with invasives, but I would imagine that there must be ways, perhaps more labor intensive. But at some point, if we're to be healthy in our environment and healthy as human beings, we'll be forced to wean ourselves away from the highly toxic pesticides and herbicides, just because of their negative impact on human health and the environment. So anyway, I appreciate your taking this on, and it seems very timely. I just had one other question. I don't want to speak to this right now, but I know that you're going to be talking about a mask mandate possibility or advisory, and will there be public comment before you make a decision on that? Or because I see comment period afterwards, and it seems to me that for a regulatory body would want some comment before you made a decision. I'm just curious about the process for that agenda item.
I believe tonight we're going to just quickly look at advisory. I don't anticipate making any changes. So with that being said, I think we'll keep all of our comment period to the end. Since I
Sure. So I would encourage you just generally, and I really appreciate that on this particular one, you're engaging with public comment before making a decision. That similarly with any other item, that there would be an opportunity for public comment before decisions made rather than afterwards, because then it's a done deal. And again, I want to thank you for this opportunity, and glad that you're thinking forward to how do we wean ourselves from really what are pretty extremely toxic and harmful materials.
Great, thank you, sir. Carol McGlinchey, you're next.
Carol McGlinchey, 10 Beacon Hill, Village of Housatonic.
Thank
I
you.
want to thank you for taking leadership on this issue. And even though you don't have jurisdiction, I want to express my concern over Long Pond, because those of us in Housatonic Waterworks district have to depend on the water from Long Pond, and there's definitely runoff into the water from the homeowners up the hill on the pond who do use herbicides, pesticides, perhaps even the Roundup. And I hope that you can even consider putting recommendations to people to encourage them to use safer alternatives, to have a little bit more of an educational awareness campaign, so that they realize that they're really impacting people's water, drinking water, with the use. And although you can't tell the homeowner to restrict this, it'd be great if you had also recommendations for homeowners and private land, as well as what you're doing, taking leadership on the town land. I'm very, very grateful to you for your conscientiousness on this issue. Thank you.
Great, thank you, Carol. Dan, you're next.
Yeah, now unmuted. I was really interested in what Kathy was saying. Kathy,
If you could just for the record.
Ann Weil, 909 Main Street. Sorry, Great Barrington.
Thank you.
My pleasure. And Kathy Reagan, we've never met, but I was really interested in what you said about wanting to know when it was applied and having some sort of notification. And my thought is, could not a public notice be made when, rather than having a permit, which is a very cumbersome and which can be a cumbersome process, which Sari indicated she wasn't enthusiastic about as a professional applicator. Perhaps an announcement or just registering with the health agent an intent to apply, and if Rebecca felt it was necessary, then to be brought forward in front of the board. But if there was a requirement for a registration for use, then in fact, there could be a public notice, which would take care of Kathy Reagan's concerns about being informed of its use. And yeah, so that's what I was, yeah, that's it actually. You know, and that it's an educational, like Carol said, it's a great opportunity to start a real educational campaign and to allow people to become informed about use and misuse, and to discourage casual use by residential property owners who may not be informed or educated about its how controversial it is. And yeah, I'm totally in favor of it.
Okay, great.
And yeah, I don't think there's anything else. Thanks.
Okay, thank you, Nan.
Yeah.
Let's see, Diana Kloss, you're next, please.
You can't suspend them anymore because, you know,
Hi, thank
either
you so much.
it hurts.
Thank you so much for hosting this. I appreciate it. So I'm actually running for governor, and I'm trying to.
If you could just state your name and address for the record.
So I'm just going to say Diana Ploss in Massachusetts. For reasons of privacy, I don't say my address, but I am running for governor, so you can look that up if you want on OCPF. But
Just want to say that we're prioritizing Great Barrington residents during this comment period time.
okay,
So
but this. I know, but this is not about my candidacy. This is about, so my question is, and the woman, I don't know if she's still here, the one that it said Town of Great Barrington, I wanted to ask her a question. Is she?
I believe that was Vivian. She's, I believe, the chair of the Agricultural Commission.
So she's the chair of the Agricultural Commission. Now,
That's
is
correct. Is it not,
okay.
Rebecca?
Okay, so I was just trying to figure out where she was getting that grant money from. And because I have a lot of concerns about Agenda 2030 in Massachusetts, and some of the things that you're talking about come directly from Agenda 2030. So I want to know where she's getting that grant money from, because I think that's important for people in Great Barrington to know where that money's coming from. And does that money come attached to its strings that you actually have to do things in the town in order to get that money? And a lot of times.
Yes, we can certainly ask where the money she's coming about is derived, but do you have a particular comment about this moratorium that we're talking about tonight?
I guess my comment is that a lot of what you're talking about, you know, the preserving the water, all of those things are coming right out of Agenda 2030. And it concerns me that this is happening, that the United Nations policies are actually being implemented in its town in Massachusetts. So that's my bigger overarching comment. And I think for people who want freedom, they should be interested in learning about Agenda 2030 and how an entity that has nothing to do with our government is influencing a town such as Great Barrington. So that's my comment. Thank you so much.
Okay, thank you very much. I had seen a Martin Mitzoff hand up. I no longer see it up. I don't know if.
Yeah, hi, thank you very much, Michael. I just wanted to comment back.
Your name and address for the record, please.
Yeah, I'm sorry. Martin Mitzoff, 960 South Under Mountain Road, Sheffield. I have the pleasure of working with your Board of Health and Rebecca Jerzyk in my role with the Board of Health here in Sheffield. I just wanted to comment that typically with regard to utilities and the application of glyphosates and other pesticides and herbicides, they will notify your Conservation Commission, and they will have to file a notice of intent, and that includes a publication to the general public that they can attend the hearing and weigh in on those plans. And the plans typically that we've seen on our conservation are very detailed, and they give more than adequate opportunity for concerned citizens to weigh in. So that was my comment to address that question. Thank you.
Great. Yeah, now that you've mentioned that, I've just started on the Conservation Mission here in Great Barrington for about almost a year. And I do remember now that the railroad came through. So I'm still becoming familiar with all the procedures. So thank you for reminding me of that and for letting everyone know in attendance tonight of what that procedure is. It's much appreciated. I believe Tom Zetterstrom, you're next, please.
I am a not a Great Barrington resident. Good afternoon. And I live at 84 Clayton Road in Canaan. For more than 50 years, I've been photographing as a native of Canaan, the woods, and noticing the changes in the landscape. I find the moratorium wording way overgeneralizing and deserving of some comment. The question about developing children as somehow going to be affected by this moratorium, those children are eating conventional diets of grains like Cheerios that are treated with glyphosate at the end of the growing season as a desiccant, and over which there should be a ban. But to mention developing children in the context of this moratorium is off base. The Nature Conservancy has said that second only to development, invasive plants have the greatest impact on the loss of native plant diversity in North America. Invasives travel along corridors, rivers, roadways, edges, fence rows. This policy in your moratorium would protect the roadsides as corridors for invasive plant distribution. That's an unintended consequence, but needs to be considered. Even Mike Nadow, one of the most vociferous of the organic control methods of land management, concedes in the article he wrote called Herbicidal Maniacs that the so-called benign chemicals are only effective on herbaceous plants, not woody plants. He then goes on to describe the technique that I'll be talking about on Saturday morning at the Berkshire Botanical Garden, which is the use of the cut and treat method to kill woody invasive plants. It uses about a drop of glyphosate. It's applied with a stamp moistener. And to consider that this, shall we say, very general moratorium would ban that use in order to possibly save a 200-year-old tree from being smothered by bittersweet vines, which I've personally done. Indeed, it was the Connecticut champion Chinkapin oak, is actually a environmental injustice. I know that Sari Hoy wanted to add some other comments. I guess I would end by saying, I think you're going about it backwards. You're creating a moratorium, and now you're trying to create a group to justify the results of the moratorium. On the other hand, the town of Mount Washington has gone about it the opposite way. They've created a committee to research the issue, to survey the invasive plants, to map them, to determine what the best methodologies are before shutting the door on certain approaches. I think Peter and Michael both, I would agree with your exemption of licensed applicators if the town needs to control knotweed. It's got knotweed growing in your little GB park at the entrance to town. It could be treated and fenced off and tagged and killed with 1 or 2 applications by Sari Hoy. I've used that company on projects from Salisbury Parks, several Salisbury Parks, to the North Campus of Housatonic Valley Regional High School, and on other properties. And they are the most judicious applicators of herbicide imaginable. They come from a background of the Nature Conservancy. The Nature Conservancy uses glyphosate incidentally, as does Mass Audubon, as does Trustees of Reservations. When applied appropriately, it does more benefit than harm. Invasive plants in Great Barrington, if you're wanting to become a pollinator-friendly town, need to be managed. And woody invasives are a good part of them. The herbaceous invasives, such as Japanese knotweed, is primarily controlled with 1 application of glyphosate. So I would say, don't be so cautious that you think that you're achieving a kind of environmental and philosophical purity by banning glyphosate while allowing invasive plants to ravage your ecosystems. Thank you, and I appreciate the opportunity to offer comment. Good afternoon, Michael.
Great, thank you, Tom. Sarah, do you have any comments?
Mike, can I just ask this gentleman a question?
Go ahead.
I have a question for Tom. Can you help us understand when the glyphosate, which is an herbicide, is applied, what happens to it?
For example, in a cut and treat method, which I'll be demonstrating starting at with an 11 o'clock lecture at Berkshire Botanical Garden. You're all invited. The Berkshire Botanical Garden is charging $15 for that lecture. Any member of the Board of Health, I will waive the fee and pay for it myself. I'm going to be talking about those projects in Connecticut where we exactly use that process as a way of, before you can do an environmental restoration, you have to rid the site of the invasives, including the roots. So when we do cut and treat, we're cutting close to the base of the plant. We're applying the buckthorn blaster, which is like a bingo dauber, to the cut stem. That chemistry is drawn down into the root system, especially at this time of the year, late growing season, September, October into November. And it prevents the formation of amino acids, which are essential for the formation of proteins in the development of the root. It then biodegrades. The half-life of glyphosate is 2 months. Microbes then, it becomes a breakdown product and it's dispersed and is no longer toxic. And as Sari pointed out, when they treated that other site for the town of Great Barrington, they did it with 4 ounces of glyphosate. I used about a half an ounce to kill the bittersweet vines that were encapsulating a 200-year-old tree, 96 feet tall, with a crown spread of 107 feet. So imagine the contrast of letting things go there and letting the bittersweet reign as opposed to human intervention to correct the problem. That is, shall we say, please come to the talks. There's still room to sign up. Go to Berkshire Botanical Garden, look at the events there. We're doing a demonstration following the lecture. I will be giving evidence of the projects that we have worked on in Connecticut. And we turned a collapsed forest, bittersweet collapsed forest on the North Campus of the Housatonic Valley Regional High School, where we have a teaching arboretum, into a pollinator-friendly meadow. And then the Connecticut Ag Experimental Station, entomologists with students collected and identified 17 species of wild bees on that site 2 years after that treatment. So the glyphosate by then was long gone from any residue whatsoever in the soils. I would add that the apprehension, rightfully, of towns in eastern Massachusetts, like on the Cape, might be concerned about leaching into water supplies because they have very sandy soils with no organic content. In our area, the organic content inhibits the glyphosate movement immediately upon contact. It's called a property called adsorption. It's adsorbed to the surface of the organic materials, which prevent migration. Indeed, when you spray, and you played spray knotweed, by the way, you're spraying the upper canopy. You don't get any on the ground. We even had skunk cabbage coming up the following spring. And by that summer, we had native plants growing in what was formerly a monoculture of knotweed. So the cost benefit was definitely in the favor of the environment. Lastly, in our area,
I don't want to interrupt you, but
thank you. Hey, let's appreciate it.
Okay.
Berkshire Botanical Garden is 11 o'clock lecture and noon workshop, application workshop. Thank you.
Sure, I appreciate your enthusiasm. Ruby, does that answer your question?
Well, the main concern that we all have is how long does this glyphosate last? And looking at different data that I'm looking at this website from Oregon Oregon State University associated with, you know, and the more we understand this, the better we can make a decision. It's a website associated with the National Pesticide Information Center. So what they're saying is that glyphosate is an herbicide and it's absorbed into soil and it really disintegrates with the bacteria from the soil fairly quickly, 8 to 9 days. And Tom is saying 2 months. It does not get a chance to get into the groundwater. And you know, the way you get exposed to it is breathing in the mist, or you feel some irritation in the throat. And so my concern is that I don't know if this is really true. Is it just is it, what are we talking about? Are we talking about exposure like in a farmland? Are we talking about exposure to our children, our pets? And we have to balance that with the invasives that are out there. So I would like to get more people to give me comments on your understanding of what does glyphosate, what are you worried about with the glyphosate use? And that's my comment.
Sure. Okay. For the sake of time, I know we've had some questions, so I'll use this as an opportunity to say any people who wish to send any of the board or any of its particular members information can do so through our department. And that's what's that email address exactly? Rebecca, is that through yours?
Yeah, you can send me an email. We don't have the chat function on our calls, so I can spell it out now, or you can just go to the town website and email me through the health department page. But I also want to say, you know, we are at 8 o'clock right now. I'm kind of getting the sense from the 3 board members that we need some more information or we'd like to amend our moratorium as it's drafted right now. So is there any motion to continue the public hearing, which would include the public comment period until our next meeting, which would be in November?
I think we're heading in that direction. I'd like to give us, say, another 10 minutes just to wrap up some of the back and forth that we've had. I know Sari's had her hand up, and I know Vivian is back on, and Kathy has a question. So if we can quickly and judiciously wrap this up, I think that probably a continuance would be the best. But if we can do this in about another 10 minutes, Sari, go ahead. I've seen your hand up.
I'm sorry, you kind of surprised me when you gave me the floor first up, and I think I wasn't ready. But I did, what I wanted to actually originally respond to was Rebecca brought up the Barnstable and the East Coast area and how they were the first areas in Massachusetts to put a moratorium on the use of glyphosate. And I think I brought this up at a Conservation Commission meeting quite a long time ago, and I'll say it to you too, that in the reason why that is pertinent and why it is reasonable for them to have put some kind of moratorium on the use of glyphosate on the East Coast is the one situation where glyphosate may move in the soil profile is in sandy soils. So glyphosate binds really tightly to organic matter, to soil particles. So when we're working in the woods or we're working here in Western Mass, if that glyphosate is getting into the ground, which, as Tom said, it rarely even touches the ground because we're very targeted and minimal in the way that we treat, it binds to soil. And then to answer some more of the questions that Ruby had, is that the variation in the time frames of how glyphosate breaks down in the environment is a lot to do with how much organic matter is in the soil, the temperatures at the time that the glyphosate is in the soil, and just general environmental conditions. So in a hot climate, it breaks down quickly, and in a cooler climate, it takes a little bit more time. But so in the East, putting those bans or those restrictions makes sense. And I think that is lost a lot in the conversation in other towns, as they're thinking about putting bans and moratoriums on the use of glyphosate. Also, when you're talking about drinking water supplies, there are some very strict regulations about using pesticide around water supplies. They're much tighter restrictions. Each herbicide, each pesticide has a label that goes with it. And let's say one of the so each product, say Roundup, is it has many products. Glyphosate is now manufactured by many companies. So, but each product has to have its label, which is approved by the EPA. One of the products is a 30-page label. I read these labels constantly because they're updated regularly. It tells you in every single situation, if you're working in the woods, if you're working in an open field, if you're working in a field where cows graze, there's all sorts of directions. The same way the EPA gives you directions on how much ibuprofen you can take at any given time. That it's a very detailed description of how to use the product. There are limits on how much that you can use in a season. You can't go over a certain amount, otherwise you're over applying. So these are the things that a licensed applicator is trained to do every time they use a certain pesticide. So, and just to answer Kathy, your question about posting, our company, whenever we're working in a public area, such as a park or anywhere where there's a trail, we post what times we work and what we're doing, and we ask people to stay away from us. And that's whether we're working with large equipment, because sometimes we're forestry mowing and not applying any herbicide, and sometimes we're applying herbicide, but we will always post publicly right at the beginning of the trail, and then we'll put cones around where we're working so that people know where we are. But that's what our company does. And just very quickly, I think the last paragraph in the letter that I sent the Board of Health yesterday, there's so much confusion around this because we keep bringing in information that is based on agriculture and how it's used in agriculture, as Tom said. What we're finding in our food is because glyphosate is used in so many ways in agriculture. It's such a huge subject and it's so confusing, and so all the information is getting sort of like melded together. But when you're thinking about harm to humans, I would say the primary source is through agriculture, through our food sources. And I was saying, so most of the pesticide-related health concerns for humans, children in particular, are related to how food is produced in this country. And then most pollinator death is caused by pesticides that are used in the wrong way or at the wrong time. And it's usually insecticides, mainly neonicotinoids, are the ones that are very commonly the cause of insect death. And harm to wild animals and pets is usually caused by rodenticides, when people are controlling mice or rats. All of them are pesticides. None of them are herbicides. So understanding the different forms of pesticide that are affecting all of our environment would be really helpful. So, thank you.
Thank you, Sari. I see Vivian's back on. We had a specific question for you. If you had just a minute or two, there's a question in terms of your grant funding. If you could or would be willing to.
Yes, exactly. Thank you very much, Michael. I did want to defend the integrity of our grant funding, which comes from the Massachusetts Executive Office of Energy and Environmental Affairs. I believe, as the speaker from elsewhere in Massachusetts indicated, that we should be transparent and we should be focusing on getting our funding from local and state sources that we know what their motivations are, and we know that they're responding to public need. And certainly clean water for drinking and for farming and for gardening and for other uses is a need that we have in this community. Can't speak for other communities, but certainly seems to be the case elsewhere. And I don't want to engage with someone from outside the area who's using this as a platform for her own campaign. I respect what she's doing, but I think we have to focus on our own needs here in Great Barrington. And the only thing, speaking of Great Barrington, I would like to second what Dan Seitz said. He kind of was very modest, but he was a member of the National Organic Standards Board for 5 years, which helped set organic standards for the whole country. And they researched so many different things there. They had a professional staff, and his concern about the fact that agricultural use of glyphosate and gardening use of glyphosate, it has destructive impact on the soil organisms, which are the basis for everything that we grow. What we grow, we see above ground, but below ground, there's a whole ecosystem that helps feed and nurture the plants and trees and woody plants that are growing. So we want to make sure that their soil has the integrity to support our whole ecosystem. And of course, that includes our pollinators, who are keystone species for growing. Well, they're involved in the propagation of 75% of all flowering plants. So we really have to support them too. So those were my main comments. And our project is one of integrity, and it's backed by the state of Massachusetts with no outside influences that we have determined. This is in response to local interest and local need for a food system that will see us through all the challenges that we're facing with climate change and with detrimental impacts on our environment, and to ensure food security for everyone in the community. So thank you very much for this chance to follow up. And as I said, we'll be in touch with the Board of Health. We hope to collaborate with you in the future.
Great, thank you.
I just want to be able to just.
I don't want to engage. I don't want to engage with you now. This is not your platform. This is our community here. Thank you.
Yes.
I also just want to add that there's someone who we haven't heard from with their hand raised, and maybe we want to hear from. I think it's Annie Crowfoot, who has been waiting patiently.
Yes, I think I would like to just reiterate that we want to draw this conversation to a close for
I would
tonight.
interject. The woman did not actually answer the question that was asked by Ms. Ploss, and Ms. Ploss is not using this as a platform for her candidacy whatsoever, but she did not answer the question.
Excuse me, if you would hold your comments to the public comment period. Annie, please state your name and address, and if you could be as brief and judicious as you can.
Okay, I'll be quick. My name is Ani Crowfoot, 210 Cottage Street in Housatonic. So just 3 quick points that I had is that what I'm understanding from this discussion is that there is a largely symbolic aspect to this moratorium, but I feel that that should not be underestimated. There's power in symbolism, and the time that it would allot us, the 1 year that would allot us to really look into whether there are really good alternatives for invasive species management, which seems to be the primary contention on this moratorium. That's the purpose of the moratorium, to give us a year to really look at this question. And most of the people in support of the moratorium on this call are Great Barrington residents, and those who are opposed are not, from what I picked up, seem to be, most of the support seems to be from people in town. So those are really my main points. I'm very strongly in favor, and I feel it's a bit frustrating the amount of time that it's taken to get this far, and to continue to shelve it is creating more frustration, I feel. Thank you.
Thank you for your comments. I know there's more people who want to speak. I feel that tonight we've made a good crack at this subject and at this moratorium. And I think for the purpose of further public comment, as well as more opportunity for our board to consider what we heard tonight, and for practical purpose of making some edits and also thinking about a variance mechanism or change to that language, I think the best course of action for tonight is to continue this public hearing until next month. And that will allow us more time to hear from the public and to also share our thoughts amongst the board.
And the public is here to be heard, and you're not being transparent.
Excuse me.
You know, so this person doesn't even have their name exposed. So we don't know who Say No to Communism is. We don't even know if they're a Great Barrington resident. I'd really like you to adhere to the meeting policies before you jump in and interject.
Yes. Thank you.
Follow your own protocol, and we will.
Thank you. So I will look for a motion to continue this meeting.
Hey, Michael.
Yes.
I just wanted to talk for a second about whether we could get a little bit more specific or take it a little bit further in that I kind of wanted to get a read of where you and Ruby are at with going forward, if we either leave the language knowing that the variance is the process, or add the language that a professional licensed person can applicate as needed, and hopefully it's going through the Conservation Commission, or we're made aware, but making it easier for them to do that. I feel like everything else about this seems to have be okay, and I want to suggest that we move forward with it, and or at least plan to edit that and have more final language if we're going to really shelve this. But I don't feel like there's a need to shelve it. I feel like we should move forward with it if possible.
Well, I for myself am leaning towards having more specific language about licensed applicators being able to use this product for the treatment of invasives. So for me, I would like to be able to have that language tidied up and have the actual document we're going to vote on. Since there is a lot of public comment on this, I'd like to, for the sake of clarity and for having everyone know what we're doing, have something official typed up that we can share on a screen at our next meeting. Or if we have to hold another meeting in 2 weeks, I'd prefer to do that than patch together something at this hour as it's getting later. But that's my take on it.
Yeah, I hear you about pinning down the language and being able to move forward with a clean version. But then I don't see, if that's our decision, that's one thing. If our decision is to open this back up to public comment, I don't see anything productive coming out of that. So I feel like if we want to be clear that we're moving forward with that particular edit clarified and then voting on it next time, that's one thing. Just delaying it is another.
Right. I guess that's my intention. That's what I'd like to see.
Okay.
Yeah.
Ruby, where are you at?
I tend to agree with what you have to say. I think that at this point, the wording of allowing trained personnel to use it with approval from the Conservation Commission, if that is the kind of wording we've been talking about, I think is fine. I think we should move forward with it and vote on it.
Vote on it in the future, or vote on that tonight?
I think that as long as the wording is reasonable to all of us, we can pass it around and agree upon it, or we can vote on it at our next meeting.
Well, I'm in favor of having having an official document that we can actually look at.
Right.
Right. Even if we have to meet briefly in a couple weeks. Rebecca, I saw that your hand was raised. Did you want to say something?
I was just going to say that I can go back and make these edits. And yes, we can have a special meeting in 2 weeks, or we can save it for the November meeting. I do agree it might be easier to make the edits offline while I can just, be really focused on what you want and how you want the wording. But you can close the public comment period time while continuing the public hearing to make a vote at your next meeting, if that's the way you want to do this, or you can continue the public comment period to the next meeting as well.
I'd like to leave both options open till our next meeting. If we certainly open up public comment time again, we can condition it for people we haven't heard from, or for issues we haven't. I know we've done that in the past. So I'd like to leave that flexibility open, but I definitely would like to see a completed specific document that we can all have a chance to look at and agree on the wording. I think that's the best way forward.
I think like where that means we're at is, Rebecca, are you clear what we're looking for in the language changes?
I think so. I think you wanted specification that you had to be a licensed applicator to apply for a variance.
No, so I think there's two things. One, at the end of the paragraph that starts with the Great Barrington Board of Health issues, so right in the middle, I think there you can just clarify that it's a licensed applicator or licensed pesticide licensed person. And then I think we have a decision, do we want to keep the variance option or not, because somebody else could apply, I guess. Or do we just get rid of that and replace it with, we're really looking for licensed people to be applying it?
I think it should definitely be licensed applicators. And
okay, and then we don't need the whole paragraph on variances.
Correct. But I think it should be specified to however the language is, either treatment or to whatever the proper word is for dealing with invasives. I think it should be specific to that.
So specific to invasive species management.
Yeah, exactly, right. That's the exact phrase I was looking for. So that sends a strong signal that while we are recognizing that invasives pose a significant risk, we're also realizing that glyphosate used in a very limited, specific, say surgical fashion is really what we're allowing, but all casual uses of it we're really discouraging or not allowing.
Well, I guess I need some more clarification, because in my mind, the option to apply for, or the requirement to apply for a variance, gave some sort of notification to the board, so we know when and where the herbicide is being used, so we can use that information to move forward with policy if we choose to do that. And Nan may have had a solution to this if you do away with the requirement for a variance, but there's still some sort of notification process to the health department and or the Board of Health, even if you are a licensed applicator, that there's a notice of intent. So is that something that you want to work into the moratorium as well, if you're doing away with the paragraph or the variance allowance?
It makes sense to me.
Yeah, I guess that what I'm trying to do is find the most efficient, streamlined way where we can be informed, but not have to have people come to our meeting and lay out what they want to do when they're already doing that with the Concom.
Just, thinking off the cuff here, I think that if there was a requirement to submit a notice of intent, that lessens the burden of going to all of these different meetings, but that we still have the information that we want, and like, you know, when this is happening, how often, and by who. So maybe that's the
Yes.
way forward.
That's why I think it's very important that we can hash this out a little bit between now and our next meeting to get the exact wording. I think we're on the same page in terms of intent, but in terms of the actual language and the mechanism, I think we need to work that out a little bit more.
Okay, I'm more than happy to schedule individual phone calls with each of you to, you know, go over language, and then I can present a refined draft at our next meeting, whenever that is.
Yeah, I think that's the best way to proceed, and that way we can be as open and transparent as possible. If you're okay with that, Peter and Ruby.
Yeah, I'm okay with it.
Okay. So I'll now look for a motion to continue this public hearing to our next meeting.
I make a motion,
What about the mask issue, though? That was on the agenda. Are we just ignoring the agenda?
This is-
This is a separate public hearing. So there's another agenda item that we'll get to that. This is a public hearing specifically for the glyphosate moratorium.
Yes. Yes, thank you. So we'll try one more time for a motion to continue this public hearing on the glyphosate moratorium.
I make a motion that we move the public hearing specific to this topic.
I second.
And I am in agreement. We'll take a quick roll call. Peter Stanton,
Aye.
Ruby Chang,
Aye.
and I vote aye as well. We need to move to this, our extension for a correction order for Berkshire Housing Services. What do we have for that, Rebecca?
Okay, so let me just get organized. I just want to walk you through the timeline of our follow-up so far with this unit. So I think we were contacted by the occupant sometime in August for a complaint in regards to mold in their unit. And we did our initial inspection on August 17th. And at that time, we didn't notice a presence of mold, but we did observe a strong mold, mildewy odor in certain sections of the unit, particularly the upstairs bedroom and two closets that, you know, one of them contained a water heater and the other one had pipes, water pipes in it. And then we also cited some violations in the kitchen. The floorboards were missing and broken. So we've followed up with a correction order for those two violations that, you know, we did observe evidence of mold, and we were requiring there to be some follow-up from the property management on what the potential cause of or source of chronic moisture could be that was causing the mold, and then also with the kitchen floorboards. And we also included some recommendations to, like, in the meantime, you know, to equip the unit with dehumidifiers, and for someone to come in and look at the mechanical ventilation throughout the whole unit, but specifically in the bathroom, because that's where the occupant was, you know, reporting more symptoms of mold when using the bathroom. And then to also, and again, this is just a recommendation, but to hire an indoor air quality specialist, because a lot of the time mold spores aren't visible, but you know, they're there regardless. And sometimes it takes some sensitive equipment to really detect that or identify what sort of mold species are in the unit. we've talked about mold a lot. So you've heard me say that mold in particular isn't necessarily a violation of the housing code, but what is what is causing it. So the source of chronic moisture, mold is a result of moisture. So that that piece is really what we cited, or that we asked the housing authority to look into. So we sent that correction order, certified receipt, so in the mail. It's how we normally get the correction orders out to property management and landlords, and we received the receipt on August 27th. And so part of our follow-up procedure is when we get that dated return receipt, then that begins our 30-day correction order timeline. So for the first 2 to 3 weeks of this follow-up timeline, we were hearing from the occupant that nothing was happening. They hadn't heard from the housing authority. So we then made phone calls and emails to the housing authority as to what's going on here. Can we get a little bit of an update? And it seemed as though someone had signed for the correction order, but it didn't actually make it to the desk of the person who could execute the contracts to get this work started. So they only really started working on correcting these violations 15 days ago, I think. So we were there for our follow-up inspection on last week and a half ago, August 28th. And we did notice that floorboards were put back into place, but that it wasn't a permanent fix. And the unit did have 2 dehumidifiers, but beyond that, we weren't really sure what else had been done. So we asked the housing authority that if they need more time, they need to submit this request in writing. So I don't know how long they're asking for. I don't know if someone is here on behalf of Berkshire Housing Services that can speak more to this, or I can just read from their written request, which I did include in the agenda packet. I'm not sure if you saw that. So it's up to you now tonight to figure out how much time you want to allot the Berkshire Housing Services, or if you do it all. So, or give someone time to speak. I don't know if the occupant is here. She said that she was going to try to log on.
Hi, yes, I'm here. Can you hear me?
Yes.
I can. Is your name Lily?
My name is Lily Forfa.
Thank you. Yes, please go ahead.
So I've lived here, it'll be coming up on 3 years in January. A year ago, I started having severe medical issues, and we've done multiple testings, procedures. My doctors haven't figured it out. I've been going in and out of the hospital, and my last trip actually, I started having like mildew. I've called the fire department for gasoline smell because I couldn't tell what it was. They've checked. There was nothing. As I was leaving my last time, my downstairs neighbor stopped me, and he told me that he goes, I don't know if housing ever told you, but before you moved in there, they were having multiple reoccurring issues with mold. He goes, I just want to let you know that, you've been so sick, this could be a possibility. And my doctors hadn't even thought about that. I had a colonoscopy, I had an endoscopy, I've had all types of blood work done. They'd done multiple allergy testings, limited my diet. And I had my doctor do a testing for me, and it turns out that I do have an allergy to mold. And I called the Board of Health with a severe concern because when I first moved in here, my upstairs neighbor had a boiler leak that actually leaked into my bathroom. And Construct, who goes through Berkshire Housing, who was our original property managers, when they came in and fixed it, I voiced my concern for the water damage that had been done. and their solution was to paint it and leave my fan on because that should absorb whatever's left. My initial concern was my bathroom because that is where I know of water damage that has been untreated. And when the Board of Health came in, they are the ones that actually found it and acknowledged what was going on with my boiler room and my water pipes, because I honestly never go in there unless I actually have an issue or something's going wrong. And during this timeline with housing, I was calling Board of Health once, if not twice a week, trying to check in, see what was going on, because I was marking on my calendar from the day I received my notice till it was going on and I had my re-inspection date. And I was keeping track because I knew they had the 5 days. And when it honestly got up to the 2 weeks, I started panicking myself because now I know that I have an allergy to it. I'm having severe health issues. I've lost over 80 pounds. I've been in and out of the hospital over, I'd say probably 9 to 12 times in the last year. And I'm scared for myself and my kids with it not being done in this timeline that something drastic could either happen to me, which then affects my kids, or it starts affecting my kids. And Berkshire Housing has always done a really good job at procrastinating with things. And Construct did it first, and I understand that Berkshire Housing just took it over. I understand that there was a lot of things that the previous ones didn't tend to, and I put my good faith in acknowledging things and hoping that they would resolve it so then my health could get better. And instead it's being prolonged. And I'm worried that another one of these spells that I get every, I'd say 2 to 3 months, is going to come out, and it's going to put me out of work again. Last December, I was out of work. I had to use almost 90 hours of my vacation sick pay because I was out the whole month. And I'm very scared that with especially winter coming up, I'm not going to be able to have my ACs running. I'm not going to be able to have windows cracked. It's going to freeze us. If I have them all closed and I don't have the type of ventilation, I'm going to get that sick again. And it's traumatized my kids. Last year, they went to school and told their teacher that they thought I was dying because I was in the hospital so much and I was so down and out. I'm scared. I'm concerned. And I put my good faith in them to just fix it. And they haven't. They showed up. It was either 2 or 3 days before my reinspection date and dropped off the dehumidifiers. And the maintenance man, I asked him, I said, well, where do they need to go, to maintain what's going on? He goes, wherever's not going to blow a fuse. And I was like, okay. And he goes, well, I didn't go over the instructions, but I'm going to leave them here for you. And then they left. And then it's told that things are on a list. They don't know exactly what the list is, but they're on it. And there's no progress. And I don't have the money to afford, a mold sport test. I'm sorry, I don't know the actual words, but, the air tester people. And it was a recommendation, and I feel like it's a really good one because it's affecting me severely. And I feel like it's something that really needs to be done so they can actually figure out what is in my home so I can go and get actual testing and try to figure out ways to make things better. But I can't do that if they're not doing anything.
I understand. So Rebecca, how much time have they had so far since our August 24th? So they've had quite a bit of time. If we don't grant an extension, what's our next step?
So the next step is to file a complaint with Western Mass Housing Court that such and such entity is in violation of our correction order, and we pursue getting compliance through the court system. So generally, before it goes to a judge, we get some mediation time between, you know, the housing authority and ourselves, and we try to reach a conclusion. And even still, that's a lengthy process. We have precedent of allowing extensions on correction orders, and I know that it is difficult to get things done in a timely way now, just with supply chain shortages. But still, if we pursue a complaint in housing court, it's still not going to happen. Like, compliance is still not going to happen tomorrow or even a week from now. So,
Well, I feel like we're coming across these issues with mold often, and they drag on far too long. And I understand some of the extenuating circumstances for that, but I feel like when fall's here, winter's approaching, and we have a tenant who's still in the unit, and these repairs haven't been done. And I would like to send a strong message that, and no one even showed up tonight to request this extension. So I'm feeling that we should make a strong statement and move definitively to get this thing moving when it seems like it's stuck in the road. So unless
May
you
I-
have yes, go ahead, Lily.
They also decided to try to serve me a 30-day notice towards an eviction for paperwork they just recently decided to fine from last year's recertification. So they're also in motion to try to evict me.
Okay, well, that's very concerning.
I'm really scared because I'm a single mother of 2 girls. I work what I can and I'm severely sick. Most of the time I get really bad nausea spells where work will send me home because they can see where I'm going. And I don't have, plan B, C places to stay. This is my A, this is my home, this is my girl's home. I just need it to be safe. They were traumatized from last year and I just don't want it happening again.
Yes, I'm really sorry to hear that. So Rebecca, that's my feeling, is that we take the next step to really send a strong message here. But I don't know how you, Peter and Ruby, feel about that.
Makes sense to me.
My concern is that with winter coming, I think the air quality is going to go downhill. I really think that we need to push for it. I think we've given them long enough time, and the sooner we expedite this, I think the better it is. I think it's our duty to make sure the residents are safe.
Okay, so do we need to vote on denying an extension, or what vote do you need from us, Rebecca?
I think, well, if you want to incorporate in your motion or your vote to deny the extension request, that's helpful because that's pretty explicit. But then also, if you can include language that you authorize the health agent to move forward with filing a complaint with the Western Mass Housing Courts, that would give me the authority to move ahead with that.
Okay. Peter, do you want to make that motion?
Yeah, sorry to repeat that additional language.
That you authorize the health agent to move forward with filing a complaint for an entity being in violation of our correction order. Or Berkshire Housing Services, if you want to be specific.
So I'm asking for you to move forward with filing a complaint with Berkshire Housing Authority. Is that the gist of it?
Move forward with filing a complaint with the Western Mass Housing Courts against Berkshire Housing Services for being in violation of our correction order.
Okay, I make a motion. And was there a beginning part of that in terms of we're not extending the current?
Yes.
Okay.
Yes, denying a request for extension.
Okay, so I make a motion that we deny the extension and further authorizing our agent to file a complaint with the Western Mass Housing Court against Berkshire Housing Authority for
being in violation of our correction order.
Just what she said.
Okay.
I second.
I'm in agreement. We'll take a quick roll call vote. Peter Stanton,
Aye.
Ruby Chang,
Aye.
and I vote aye as well. All right, thank you, Lily, and I hope we can move this along as quick as possible and get some satisfactory resolution to your issue. And we're, again, I extend my my real concern, and I'm going to stay on top of this and get it moving as fast as we can. It's very frustrating with issues like this for me and for our board. They seem to drag on longer than any of us are ever happy with. And we're also very concerned about any eviction notices. We take that stuff very seriously, any hint of retaliation against tenants. So we're going to be keeping a close eye on this issue. And thank you for coming tonight.
Thank you so much, guys.
And I just want to add too that, you know, it's beneficial that we move forward with a housing court complaint because there, like I said, there is a mediation process. And, you know, for tenants that can't afford a lawyer, we can lay out our timeline. So any retaliation is pretty laid out, that, you know, the health department came at this time and an eviction or notice was served at this time, and, you know, have that piece worked into our complaints so the tenant doesn't have to, you know, hire their own legal aid. So we can kind of hit two birds with one stone.
That's great. I would word it that way.
Great. Okay, thank you again.
Thank you all.
Let's move over to our department updates. Is there anything that you want to go over with us?
Okay. Just one thing. Last week, the Department of Public Health's annual seasonal surveillance of mosquitoes that happens from, I don't know, like May, June until first week in October was concluded last week. And they did end a week sooner than they normally do because they wanted to make room in the lab for more COVID testing. But I just wanted to let you know that that monitoring season is done, but they are still testing humans that are presenting symptoms of West Nile or Triple E or any sort of arborvirus for those diseases. But they're just not, you know, mosquito testing anymore. And when I wrote this update, we were still having hot and humid weather, and it's kind of subsided in the last week. But we were getting a lot of complaints in the health department about mosquitoes and what the Board of Health does to suppress mosquitoes. And, you know, our policy hasn't really changed in the last 5 years since I've been the health agent, that, you know, we don't allow any insecticide spraying during these hotter months. So, but anyway, despite the complaints and the higher level of complaints, and despite, you know, the increased amount of mosquitoes that we all experienced this year, our weekly arborvirus reports were always minor to moderate risk. So, you know, that is getting some mosquitoes into the lab that are carrying Triple E and West Nile, but when they're pooling these insects, you know, the risk level is still low to being having a human bite by one of these infected mosquitoes. So I just wanted to put that out there. I hope that made sense. I'm getting a little tired. That, you know, despite the increase of mosquitoes, we still had a really, really low report all summer for these arborvirus diseases.
I think just to reiterate is that it has been bad, and trying to and encourage everyone to make sure they dump out all the standing water around their home, not having tires that are left where there could be standing water, and covering your bodies with long sleeve clothing, not going out toward the evening hours, even though it was bad all day long. Those things are still in effect and can be easily accomplished.
Thanks, Ruby.
Thanks.
And I wanted to include in my update that I was invited to participate in the Great Barrington Housing Authority monthly meeting last week. And I think 2 months ago, I reported to you guys that we were getting some complaints from Flag Rock Village units about mold and other potential violations. And so I was invited to speak at this housing authority meeting, and I thought it would be beneficial for the board as well as the admin to hear what our complaint follow-up process is. So, we can have a working relationship with the Great Barrington Housing Authority, and they're not just being served these correction orders. And I really think that, of course, there's multiple sides to every situation. And, a lot of the time we are just hearing the tenant side. But the better working relationship we have with the Great Barrington Housing Authority, I think the better and more efficient repairs and corrections can be made to code violations. So I hope that meeting and my presentation was helpful in trying to better relations with the housing authority.
Thank you.
Great, thank you. Anything else?
That's it.
Okay. I don't have any questions. I don't know if you, Peter, Ruby, if you do, or you want, we can move on to our next item.
Ready to move on.
Okay. Get the floor again, Rebecca.
All right. So it was nice to have the Public Health Alliance here at the beginning of our meeting. It's been a while since we've heard from them, and I think they want to get back into the swing of visiting with their boards of health. And I hope that whether it's the next meeting or maybe in December, we can also hear from the newly established Southern Berkshire Public Health Collaborative Nursing Team, which was, as I've said before, it was established through the Public Health Excellence Grant that, the Public Health Alliance was also able to hire more nursing services to. So Great Barrington is benefiting from this grant in a variety of ways. We get extra nurses with the Public Health Alliance, and we're also getting really great data analysis from the Southern Berkshire Collaborative. They can't really speak so much in terms of COVID numbers because that's handled by the Public Health Alliance, but they're giving us a good picture of what's happening in South County because they are doing COVID follow-up for 10 other South County towns. So anyway, I think it'd be really great to have them on a future agenda too, just so we can have another meet and greet and they can talk about what's happening in South County specifically or what has happened in South County specifically. Okay, so for September, Great Barrington had 24 positive cases, and I was really happy to hear Leslie say that we still have 0 cases because she gave me that update on Monday. And so I thought for sure that between Monday and now something had changed. But so this is the first week since May that we've had 0 new cases. We still have 3 active cases that are still on quarantine. But that's really great news. Mm-hmm. South County is experiencing a similar trend and decreasing numbers. In September, there was a total of 102 positive COVID cases for these 10 towns, which is Great Barrington, Lenox, Otis, Lee, New Marlborough, Sheffield, Monterey, Mount Washington, and Stockbridge. So a pretty sizable region. But just for some perspective and how that's different from Pittsfield North, Pittsfield in the last 2 weeks has had 115 positive cases, just like I said, in Pittsfield alone. And we got an update from Dr. Dan Doyle, who works at Berkshire Health Systems, who also chairs the Dalton Board of Health. And he reported that Berkshire Health Systems lab tallied 258 positive cases in the last 2 weeks. So South County and Great Barrington is faring a little bit different. I don't know if you saw the graph that I sent around from this Southern Berkshire Public Health Collaborative in the agenda packet that kind of showed South County numbers going down and North County just kind of staying, like plateauing, but then also going down in respective to their trend, if that makes sense. So that's my COVID update.
Okay. Is anything to, in terms of our standing public health advisory? I know we spoke on the phone and it seemed from our conversation that we didn't have to do anything with that month. I'm still under that assumption. So I don't know if you have anything to add officially on the record or if you want to weigh in, Peter or Ruby, about it. To me, it seems like we should leave it as is and again, look at it next month, as this is, at this point, is definitely a recurring agenda item as we move into the colder winter months.
I believe that we can move forward with the way it's currently written.
I agree. I just had a thought about people feeling unsafe in certain situations or locations where people feel that people are not adequately masked indoors or not adequately vaccinated. And I was wondering whether individual stores have the right to post what they've done to keep the public safe. I mean, do we have any way of requesting each of the stores to document, what they've done so far? Just so when people walk into the store, they have an idea what they're getting themselves into. Do you understand what I'm trying to say?
Yeah, I'm glad that you brought that up because just this afternoon alone, I had 2 conversations with 2 separate people about that, going into a restaurant or going into a business, they weren't sure what the policy was. They walked into a restaurant and, we have this advisory, which I think is good and still applicable given our numbers, but the employees weren't masking. And then this person was then told, well, all of our staff is vaccinated. And this patron still felt unsafe and they had made a similar request to the health department that, there be some sort of notification upon entering, like what you've done. And I don't know if we can work that. I think all we could do is work that into our advisory at some point, that businesses are strongly encouraged to promote the public health strategies that they've implemented to keep patrons safe and to mitigate disease transmission. I think that would be a very valuable addition to our public health advisory, because it does seem that businesses in town are taking it seriously or taking what works for them and incorporating it.
Right. So at least it helps the people who are walking into a location, they have an idea of what policies are in place and what each of the stores have done. And that way they can make their own choice as to whether they should go in and patron the particular location.
It seems like most of the stores downtown do have some signage. And often, or several of them are more on the kind of suggestion side.
You mean in terms of actual signage on the door for what you need to do when you walk in, or for what they have done?
More like they're saying, keep everybody safe, please mask up, or however they phrase it. There's a suggestion of masking without only. It seems like it's more like that than it is like you have to be masked to come in here.
Right.
So I think they're pretty much on the suggestion side.
Right. So stores that can post what their policy is for entering the building and what they've done to protect the customers, I think is really beneficial for those who are patrons of certain places. But it also protects those who may feel uncomfortable with going in and asking specific questions.
So the only thing I'm wondering right now is, because it sounds like we're talking about potentially amending the current advisory, is why don't we wait to see where the numbers go? And if the numbers are staying where they are, I don't see a need to add. But if we do see some more cases happening around Great Barrington, then it seems like that's something we could revisit.
And also, Ned is just in restaurants. We're not in every business routinely, but we are in restaurants routinely. And I don't mean to speak for you, Ned, but I don't think he would mind having a conversation with restaurant owners if they're present. Like, what are you doing? How is it going? What are the barriers? If not masks, if not vaccines, then what? Like, what are you doing? So we can sort of so it's not necessarily amending our advisory, but we can still have a conversation to ensure that safety measures are being taken.
Mm-hmm. I think there is some time limitations on this, mainly because winter is coming and more people are forced to be dining indoors as opposed to outdoors. And so it's good for business as well for them to be able to post what they've done so that they are getting more business. It's not just for protection of the public, but it's also better for business. If everybody posts, then they're not standing out. Because what my concern is that when the weather's already cooled off a bit, and the windows are going to start be closing up. And I agree that we don't have any numbers at this point, but what's going to happen when it gets so cold that you can't eat outside anymore?
You just eat at home.
So, Rebecca, in terms of your comments, I was thinking, or your idea there, that my suggestion is that it would be clear that it was a polling and not related to a health inspection or related to a position. That gathering that information from the restaurants, I think, is a fine thing to do for us to get a sense of where, what practices are in place. But being clear with them that we're just gathering information.
I think that's a good start.
Yeah, I'm in favor of having a more informal approach, and if businesses want to post what their policies are and what they're doing, I think they should be free to do that. I don't think, I'm not in favor of having anything like that in our advisory. And certainly Ned can do the work of talking to people, and I think that's a better approach. And just as we put out advisory, I think people can make those decisions for themselves.
And maybe keep track of who does have signs, and not necessarily specific to each business, but if most of the restaurants have signs, my impression is they do.
Yes, I haven't seen many doors that don't have some sign on it, and so if they want to do more than that, they certainly can. Did you want to add something, Rebecca?
I just wanted to add that before we head into the next, But before we head into citizen speak time, I'm gonna take a little bathroom break, but you can move on without me. But I just wanted to tell you why my screen was gonna be blank for 2 minutes. But we can go through Board of Health questions and updates first, if you'd like.
I would want to, I think there's a couple things we might want to just say before we go into public speak time in terms of what our jurisdiction is and isn't. I think just based on some of the communications that have been going around, it's probably, and tell me if I'm wrong on this, but I don't think that we have jurisdiction over policies that happen in the schools regarding masks, vaccinations, or anything, any of those that's outside of our influence.
Right. The school committee has jurisdiction over policies and procedures of what happens in our school district, and they are getting safety standards and guidelines from state departments, just like we're getting safety standards and guidelines from the Department of Public Health. It's called the Department of Elementary and Secondary Education, DESE. And the school committee is interpreting those guidelines and deciding whether or not they want to go above and beyond them for this to implement in the schools. We don't have any jurisdiction over what goes on in the schools. You know, at the very most, all we could do would be to send a recommendation letter to the school committee. But even then, they don't have to take our recommendation into consideration because they have ultimate authority.
Okay.
Did you have anything else to add, Peter?
I think that was the main one.
Okay. Did you want to say anything, Ruby, before we go into our general citizen speak time?
No.
Okay. I just want to make for just a practical observation. We're already at 2.5 hours. I'm going to set our meeting limit at no more than 3. But I do want to definitely hear from people from the public. There have been people who've waited our entire meeting. I have 2 hands up that I'd like to get to. I know Kathy has mentioned something, but I'd first like to hear from Eileen, because I know you had your hand up a while ago. So did you have a question for us, Eileen?
I just have a question. What is the time and the date of your next meeting when you're continuing the hearing on the moratorium?
I think we'll talk about that right before we adjourn for the night. Depending on how things go, we may be in 2 weeks, but we'll take that up. We'll give you an answer before the end of the meeting.
You have to, under the open meeting law, you're supposed to set the time and the date before you continue the hearing.
This is correct. Well, I would assume that it will be at our next regularly scheduled meeting.
I don't know when that is.
Which is always the first thing. I'll pull it up real quick. It is November 4th is the first Thursday. So it will be on November 4th.
6:30.
Yes.
Thank you.
Yep, thank you. Okay, Kathy, I see your hand. You've already mentioned your name. If we can try to keep comments to about 3 or 4 minutes, we can get through as many people as we can in the next half hour. So please go ahead.
You're talking Kathy Regan. I just want to make sure there wasn't another Kathy.
Yes.
All right. With all the COVID procedures, whether it's for masking or, social distancing, the stores actually putting signs in their windows. Has anybody talked about the fact that CDC Director Rochelle Walensky had actually said on air recently to Wolf Blitzer that the vaccines do not stop infection or transmission. So, that's a personal choice. If you want to do a vaccine, that's great. It's something you want to do, but it doesn't protect anyone else. So that's something that really needs to be clearly discussed, and because people are living in fear, and that's not a solution for protecting others. According to our agencies, according to the agencies supposedly people trust. The other thing is anybody sharing the actual survival rates? I mean, does anybody even know what the survival rates are according to Stanford University right now? I mean, for kids, it's 99.9973%. And the actual truth is right now, the injection has killed more kids than have died from COVID. So people need to get these actual stats. Right now, from 60 to 69 years old, their survival rate is 99.41%. So, these cases, people are talking about cases, but it doesn't mean anything more than getting the flu necessarily. If we're not talking about deaths. I mean, how many deaths have actually been happening? I think that's what we really need to talk about. And I think we need to give people the survival rate so they're not living in fear. That's not being talked about by any of the health agencies. Another thing that's not being talked about that's very, very concerning are the actual stats from the CDC about the deaths and injuries caused by the COVID vaccines. We're up to almost 16,000 deaths directly caused by the vaccines. And everybody knows that's a very conservative number. It's only like really 1% to 5%, 10% most that are actually getting reported to CDC's VAERS. And that's the only reporting system that's supposedly capturing all the data for injuries. So we're talking 16,000 deaths. I mean, really think about that. And the injuries, which include heart attack, stroke, they're up to almost 800,000. Real people that have been injured, permanently, some of them for the rest of their lives, totally incapacitated by these vaccines. So again, it's a personal choice when it doesn't stop transmission or infection. And I don't think this is being taken into consideration by the health department or anyone else that is making recommendations to stores and people to put up, signs on stores that are extremely discriminatory. Whether you've been vaccinated or not should be a personal opinion, whether you want to wear a mask or not. There's so much peer-reviewed studies right now on masks. I mean, show us the studies saying that they actually really work. Show us those studies. They're not there. So I think we need to really look at the science and really go by the science. And I do get frustrated that not just us in Great Barrington, but across the nation are not actually looking at those numbers from the CDC and other places that are supposed to be, the gold standard. So that's my 2 cents. Did you want to say anything, Kevin? Because Kevin didn't get a chance to speak earlier.
We got to discuss some of the legal stuff. I mean, there's laws on the books, places of public accommodation that specifically says you can't discriminate for any kind of thing that the store owners are doing. They're saying you got to wear a mask to be vaccinated. That is against the law. It's a public law, state of Massachusetts.
And there's lawsuits all over the nation happening now because of it. So I think that the Board of Health has an obligation to really take this into consideration. And we know you've had a tough job and it's been a tough year, but I think this is a priority. We have to look at these numbers. And my one question to you to end my comment here, because I know we have a lot of people to listen to, is how are we going to address this? Some people have sent in information to you. I have a ton. I like to go right to peer-reviewed studies because I think that those are non-controversial. I have a ton of those I can send you, but if I'm going to spend my time doing that, I don't want to feel like it's just gone into the abyss. How can we actually sit down? We're talking about intelligent people here that are really looking at the actual real numbers and the scientific information, like I said, peer-reviewed. So how do we know that once we send something into you, it's actually really, truly being considered? I want to know people are understanding the studies and looking at the actual numbers and the implication of those and how it affects Great Barrington. So that's my question. How are we going to follow up with this and actually review this material?
I'll just take this quick moment to reiterate that the function of this part of our meeting is to hear from citizens, not necessarily address every question. But I will say that any information you send to our department that's through Rebecca that comes to us, we do look at it and we do take it seriously. And as you mentioned before, these are not simple issues. And I just want to say that from the outside. So please send us anything that you think we should see or that you want us to see. We do look at it. It is considered.
Will you share the survival rates with the public? I think an obligation that we all have is to calm down the fear where the fear isn't warranted. You know, I knew people that didn't have any clue of how many, even what's considered cases. They had no clue of what was happening and where to look for that information. And I've directed this and them to some of the information, you know, even put out by Pittsfield Hospital and BMC. And, you know, they're so surprised. So I think we need a better communication about the positive aspects that are happening instead of just disseminating fear, which is no good for anybody. You know, really, it's a shameful thing, kind of what's happening across the country. And I think we can do better than that here.
Point taken. Thank you for your comments. We're at 5 minutes there, so we want to move on to, I see Daniel Seitz' hand is up.
Good evening again, and thank you for an opportunity to, thank you for this opportunity. And just to say, I've spent 30 years involved with medical education, accreditation, regulation, and I've spent literally probably 400 to 500 hours reading medical studies, listening to doctors on the subject of COVID. And the types of statistics that Kathy is referencing is widely available out there, put out by different people. People have compared the rates of cases and the rates of deaths in states where there are extreme mandates and measures taken in relation to COVID and where there's not. And you can really see that there's a real question about whether the approach that's been taken in Massachusetts in any way has been beneficial to the public. And we certainly have seen that there have been very dramatically negative impacts on businesses, individual livelihoods, and so forth from many of the measures, including the shutdowns and so forth. But I'd like to say that Ruby mentioned that someone had come up to her and expressed fear about going into stores. And it's essential that public health policy is not made based on subjective fears. There are people who are extreme germaphobes out there, people who have all sorts of own psychological fears about aspects of life. That's not a basis for any sort of regulation. I'd also like to point out that Dr. Fauci, who's been so revered for the advice that he's given and his role as in the CDC, he said early on that masks don't work. He said early on that asymptomatic transmission is not an issue, and there is ample studies from 40 years, over 40 years, that masking to prevent viral transmission is just simply not effective. The openings in masks are far bigger than the virus particles. And then the fact that people go into restaurants and when they sit and when they eat, they take off their masks. But when they get up and they walk, I mean, you can see that it's really more of a theater. And even Fauci referred to the use of masks as more of a performance art. I'm paraphrasing. Then yes, and then as being effective. So I think it's important to again take a look at these studies going back decades rather than making something based on sort of the fears that are being expressed. And then finally, I think if people are aware, the CDC itself had said of many of the testing processes out there that they actually were not accurate. They've withdrawn some of those. The inventor of the PCR test himself said this is not a test to be used by itself for measuring whether someone has an infection. There's so much science and scientists around the world, doctors around the world, who are offering a different point of view. So I just want to second what Kathy said, the importance of doing a very wide and deep study of these issues before you take any action. Finally, I want to say that a health inspector going and asking restaurants and so forth their practices has an intimidating quality to it. This is a regulatory body. I don't know that it's their business to be inquiring in that way. And I would just simply say, Let the businesses handle this as they would, let the patrons handle it as they would. And health department can't possibly address everyone's subjective fears about where they go and what they do. Thank you very much.
Great, thank you, Daniel. Matthew O'Brien, you're next, please, sir. State your name.
Can you hear me?
Yes, we can.
Okay. My name's Matthew of the family of O'Brien. I live at 33 Van Duzenville in Great Barrington. And just for disclosure, I'm a new member of the Massachusetts State Jural Assembly. And I just had some comments to make about, I don't know if how many people know that the state of Massachusetts and the town of Great Barrington are both corporations, you know, on Dun and Bradstreet. And I'm seeing a lot of information coming from the top down, you know, of what we should be doing health-wise and what they're telling us, you know, and I think it's the same in the corporations as it comes downhill, all the way down to the store owner, who is almost at the lowest level, you know, and they have to, they can be sued, you know, you guys can be sued, even though you say that probably jurisdictional wise, the schools you're not connected with, but they're still under your authority, the children that are in this town. And so I was just thinking there's just a few simple things, you know, basically, you know, there's a lot of information on masks and what they can do and what they can't do. And also the damage that's done physically and psychologically to children that I think really needs to be looked at. The other thing the other gentleman mentioned was the PCR test is being phased out because it doesn't work and it was never designed for this. So there are so many false cases because of the dialing up of this test, which should have never, ever been used for diagnosing, you know, infections. And just the fact that all around the world, everyone is doing FOIA requests to find out if they have isolated the virus, and no one has been able so far in many countries, including the US, to have anybody in authority have an isolated virus that they could have made a vaccine for. So these basic three things I think really need to be looked at because, you know, you're liable, so are the storekeepers by doing certain things. And they're the ones, like I remember I went into Cumberland Farms used to have a sign up for masks all the time, you know, and okay, cool. But then all of a sudden the sign comes down. So I'm asking every time I'm in there, what's the story? Why'd you take the mask down? They don't want to tell me. One guy working there finally mentioned that they were sued. One of their chain was sued. So boom, all the you know, masks are off. And I don't want to see you guys or any of our store owners in Great Barrington having to go through the same thing. And I think, you know, the research, again, what Kathy mentioned and some of the others is very important, even for you guys. You know, I know that you're doing recommendations and things, but I don't want to see, you know, any of you going through any kind of problems because of this, you know, and it's coming out now what actually happened in this whole, you know, so-called pandemic. But I just wanted to mention that so you guys, you know, I think you're doing a good job and, you know, doing the best you can under these crazy circumstances. And I just wanted to mention that you know, that could be a consideration that you need to have this information available, you know, all the time, just the basics about, you know, the isolation of the virus, the PCR test, how they're testing, whether cases are actually real, you know, and also masks for children. You know, it's their choice if you want to wear a mask or you want to take a vaccine, or I think that's a great choice. Everybody should have choice. But, you know, when it comes to kids, you know, I think, you know, the health department needs to be vocal and find out about this and even maybe speak to the school once it's found out. But that's all I had to say. And thank you for allowing me to speak tonight.
Great. Thank you, sir, for your comments.
Thank you.
Cardinal Jackson, you're up, ma'am.
Hi there. Can you hear me?
We can. Name and address, please.
Okay, great.
So I'm not going to say much because I feel like everybody who has spoken right now has covered pretty much everything that I would have wanted to say as well.
Could you just state your,
really
I hate to interrupt, could you just
Sorry?
state just state your name and
Oh,
address?
sorry,
for the record.
Cardinal. Gosh, by now I should do that right after all the Cardinal Jackson, 21 High Street, West Stockbridge, on the Housatonic town line. So
You're a West
agree
Stockbridge
with-
resident? But
yes.
Okay, so we're just going to prioritize folks that live in Great Barrington first. Is that
Right? Do you have other people who are waiting to speak right now?
I don't see anyone, but if you could keep your comments as brief as possible, that will give.
I will.
Yeah. Okay, so please continue, and I would encourage anyone, we have about 10 or 12 minutes left, if you raise your hand if you want to speak tonight. But please go ahead, Cardinal, and you got about 4 minutes left.
So I don't know what kinds of decisions you guys are going to need to be making and in what timeline. This is such a huge topic, and we were pushed to the very end of the meeting where, you know, I get it. It's a lot once a month. We may need to have another meeting just on this if decisions are going to be made. That's just the feeling I'm getting. There's so many people that would like to speak up. I've sent you a letter with a lot of links in it. When I hear you speak about possibly checking into what restaurants are doing, and, you know, I get it, it's all well-intentioned, but I do feel that, and there again, this is entirely your choice. And Dr. Ruby as well, I really feel that you believe 100%, maybe this is not true, that these vaccines are actually working and that masks are actually working. And I would hope, all I'm asking is that you do everything you can to research things that you have not researched yet, because there is a massive amount of information out there that says otherwise and that proves otherwise. And I'm hoping that whatever decisions you end up making will come from a place where you have not already made up your mind that these things are working. They're not. There's plenty of evidence there to prove that. That's all I wanted to say.
Great. Okay, thank you, ma'am. Kathy O'Malley, I see your hand. You're up. If you could state your name and address for the record, please.
Yes, hi. I'm Kathy O'Malley, and I live at 45 Lakeside Drive in Great Barrington. And, you know, I've been listening to all the comments and very interesting. And there is a lot of data out there supporting the questionable effectiveness of both the COVID vaccine and masks in particular. I am 67 years old. In my entire life, until this past year, I have never had to wear a mask, you know, when I'm out in public. So I'm thinking about children and how scary it would be and how scared I would be if I was told, like, you know, hey, you know, the germ is going to get you, the boogeyman's going to get you, and you have to wear a mask. So I think there's a heavy burden on your shoulders to prove that, in fact, that it would be efficient and effective. And I just wanted to point that out, that I work in a restaurant, and I wear a mask, and you know, I feel a little safer. But yeah, people do take their masks off when they eat, and then they put it on when they leave. But I just think it should be voluntary whether you decide to wear a mask or not, because, like I said, there's all different data out there to support that. You know, after this year and a half we've been going through with the COVID, it's kind of coming around and, you know, kind of settling down. So I just wanted to share that. Thank you.
Thank you. Is there anyone who hasn't spoken tonight who wishes to do so? Please raise your hand. Not seeing any who haven't already spoken tonight. last call for anyone who hasn't spoken. You know, we have a lot in attendance tonight, and I do value, I think the other board members as well value this portion. You know, historically, our meetings were never this well attended. When I first began my service on the board about 9 years ago, we had, you know, including the board, less people than you could count on two hands in our meetings regularly. And here we are 9 years later, a lot has changed, the world has changed, and I'm glad to see so many people here. Sometimes we have more, depends on our topic, and I get that. And I did want to take this opportunity to say that, and I'm not trying to speak for other board members, I'm proud to serve with Peter and Ruby. I think we represent a good spectrum of perspectives. We don't often hash things out between us. We have a very upstanding civil discourse, and I've always appreciated that to my fellow board members. For myself, I've been thinking about a lot of these issues. I've received a lot of communications from people in our community with a lot of information. I just want people to know it has been seen by us, it has been seen by me. I have read through these things personally. And I feel it's important to say that for myself personally, as well as a member of this board, I sympathize with a lot of the points that are raised and the questions that are raised. And throughout this whole pandemic, there has been a lot of concerning things. When it first started, no one knew anything, and there was a lot of fear, and there was a lot of unknowns. And as a local board of health, we're kind of the last link in the chain, and I've always viewed our role as one of disseminating information. And we do look to those institutions that are bigger than us, whether it's on the state level or a federal level. And historically, we've looked to them and we've sought to pass guidance along. As this pandemic unfolded, we had orders that came down from the state mandating things. And as most people are aware, if the state says something, you know, you can't say less than that. And so your hands are tied in there, whether you agree it or not, when it comes to public health policy. So when the governor's orders came down, that became the de facto rule of the land. And I understand the arguments against those. I just understand the people not agreeing with it. And I understand and I get it that there's lawsuits out there. But I think people often don't underappreciate that we, our board, and I feel the current members especially, have sought to find a middle road. And I think in this current time, that's why we sought to put advisory into place. And we do live in a free country, and we do cherish personal freedom. And I think that's particularly why I myself was in favor of, say, like a local advisory. So we say, this is what we advise. As a local health outlet, we're trying to get information out there that is passed down. And we advise, and we've steered away from mandates, and I think for good reason, although I'm sure that we have some different views on that, but that's where we've come to. And so I want everyone in attendance here to know on both sides of the spectrum, we've heard of people in our past meetings advocating for vaccine mandates. We have people coming and advocating for masks being taken off their kids in school. These are big issues. But I also want to say, for a local board, this is not necessarily the forum to have long form debate on the validity and pull up things and hash out arguments. Those debates happen at the national level, and it has been very discouraging over the years to see how that debate has been stifled, and it has. But like I said before, people should send us everything. We do read it. We do take it under consideration. But I just want to impress upon people to know that we are trying to, I myself am trying to plot a middle course so that people can make decisions about their health with the best information that they have. And that's why I've always applauded people to come and speak at this session of our meeting and to share information with the public. You may not agree, or you may heartily agree. I appreciate all perspectives that come here, and I'm glad that people speak up. So I felt it was important to say that. So for all sides of the debate, I know this COVID has brought out some of the worst in our country, has brought out some of the best in our country. And I want to know that I myself, and I hope my fellow board members, that we don't take this job lightly. And it is, while it is a difficult job, we are trying to do the best that we can. And that's why we're always eager to learn new things and have information to look over whatever is sent our way. So we're about at 3 hours. I just want to quickly ask if there's any media questions before we adjourn for tonight. I think Eileen is our long-standing media attendee. I know there's some others here. So if you have questions, now is your time to ask. And not seeing anything, I'll just ask members of the public, if you, members of the board, sorry, if you have any further comment before we call this meeting adjourned for the night. Not seeing any. I want to thank everyone who's attended tonight and everyone who's spoken tonight. And as I mentioned to Eileen, our next regular scheduled meeting will be on November 4th. I'd encourage anyone who wants to speak or who didn't get a chance to speak tonight to come to that meeting. We'll have another one of these open forums. But I will take a motion to adjourn the meeting for tonight. You're unmuted, Peter.
Yep, I make a motion that we adjourn the meeting tonight.
A second.
And I'm in agreement. We'll take a final roll call vote. Peter Stanton,
Aye.
Ruby Chang,
Aye.
and I vote aye as well. Again, thank you everyone who's attended. Thank you everyone who spoke. It's good to have the public here at our meeting. Thank you, and good night, everyone.
Thank you.
Thank you.